All right. Hello, everybody. This is Dr. V's Revolution Will Not Be Pesticides. And I'm here with a special guest, Dr. Garth Vaz. And for those of you that watch my channel, you guys probably already understand that this is a channel. It's about a mixture of history. It's about health. It's about gardening, kind of mix all those things together. So I said, what better person to have on my channel than my uncle, Dr. Garth Vaz, who has a great story to tell. And he actually medical doctor who started his own business recently with cannabis, and he's going to present his experience to you guys. So welcome, Dr. Garth Vaz.
Thanks for having me, Neil. Or should I say Dr. Vaz?
You can call me Neil.
Okay. Yes, it's a pleasure to be here, and it's a pleasure for me to share my experience and my thoughts with the world.
So one of the things I wanted to really touch on is because lately we've kind of both gotten into the same thing. My grandmother, which is your mother, was a gardener. She used to love growing her food in the backyard and doing things the natural way. So recently in the past 5 years, I started doing the same exact thing, as many of y'all know, and just growing my own food and growing my own herbs in the backyard and resorting to some of those things rather than going to the pharmaceutical companies to get what I need to feel better. I've personally seen improvements in my overall health just with resorting to growing my own stuff, and not only that, it's just not only like the physical aspect of growing your own food, but just it's kind of like more like a soothing feeling to be outside with nature, to dig your hands in the dirt and do all those kinds of things and just see the process in which the food is being produced. So you were telling me recently, I think within the past few years, that you were starting to do your own version of gardening. But this has to do with your profession. You're a medical doctor. You've been a medical doctor for decades now. And I want to know, and I also want the viewers to know exactly, like, who are you? And tell me about your background and what got you interested in medicine in the first place.
Well, my background is I grew up in Jamaica until I was 19 years of age and migrated to the United States. Prior to my migration from Jamaica, I had quite a bit of experience there with quite a bit of gardening, actually. Survival was necessary. Gardening was necessary for survival. My mom, of course, trained me, taught me quite a bit, and helped her from I was a kid in the process of gardening. And we had some exciting experiences on the island of Jamaica that led my brother to write a book, The Doctor He Begged to Be, and it's published now. You can get it on Amazon, or it's there about. So, and what led me to medicine? I think my mother probably brainwashed me, you might say, and because ever since I knew myself, I knew that my goal in life was to be a medical doctor. All four kids that my mom had, and all four of us sat down one day, and my mom had us choose our profession. My brother was going to be a preacher. My oldest sister was going to be a nurse. My younger sister, or younger sister, was going to be a school teacher, and I was going to be a doctor. So my sisters pursued their career. My oldest sister became a nurse. The sister that followed her became a school teacher. And in my 30s, I called my brother up and told him I was going to be thinking of going to medical school. And then he got frightened. He said, "Ooh, am I going to be a preacher?" So I said to him, I said, Donnie, don't worry, you don't have to do what I'm doing. You do not have to follow mama's recommendations or ideas. And so I took off and went to medical school. And the beautiful thing about it is that having an opportunity to change people's lives and listening to their stories. A few nights ago, I was in bed and I thought to myself, I have been listening to many stories of patients solving their problems and so forth. And I looked at myself and said, who is solving my problems? But then again, I guess the God takes care of that part of it for me. But it's to me, medicine is not a job. It's a calling that when a patient calls me, I joke about it a lot that tell them to call me right around 2 o'clock on Sunday afternoons. That's about the time when I'm supposed to be doing my honeydews. So you call me so I don't have to do honeydews. Give me a break. So because I really do enjoy doing my honeydews too. Of course, my wife might watch this, so I might want to say that. But also I enjoy taking care of patients, and calling me in the middle of the night sometimes it's okay for them to do that. Did I answer your questions?
Yes, you did. Yeah, perfect. Thank you. I have another question. So after all these years of practicing medicine, in the past few years, there's been a little bit of a change, right?
Yes.
There's now some states have legalized cannabis. After all these years with you practicing, I guess, medicine in the traditional pharmaceutical corporation kind of way, why are you, what's going on? Like, why are you changing your tune after all these years?
Well, I might add the word exploitatory to we've described in the pharmaceutical system and so forth. It's one of the things that I in Texas, for example, has not permitted cannabis use for recreational purposes. And by the way, I really have reservation about using this drug for recreational purposes. I think it should be controlled in the same manner that alcohol is controlled and so forth, with specific places that can be purchased and so on. But what has happened, I think, when Ralph Matsuda discovered the THC that was found in the cannabis plant, that is what they found that caused the euphoric effect on individuals, and the studies stopped there. And this was back in the 60s. All the studies on the cannabis, and so the plant was masked with the idea that it is a euphoric plant, and so it was not looked at any further at all. It wasn't until later on, I guess, in the 90s, when Lisa Matsuda, with the National Institute of Health, found that the body does have two receptors, and that there were neurotransmitters that were produced by the body. And so that sparked my interest. Before that, prior to that time, patients were always having, I give an example of a patient of mine that was dying with lung cancer. And, well, I said not dying. She had lung cancer. She wasn't on the deathbed yet, but she was having a lot of pain, and she was suffering from anorexia. She wasn't ingesting food at all, pain, anorexia, nausea, and so forth. And someone came to my office and left some samples of Delta 8 in the clinic with me. And
Can you explain Delta 8?
oh, that tetrahydrocannabinoid has many types in the system, included in tetrahydrocannabinoid, THC.
THC.
Delta 8 is one that is basically synthetic, although the plants do make some Delta 8, but it's not enough to concentrate to be utilized by the body. And Delta 9, of course, is the most popular. That's what they call marijuana or ganja, depending where you're from. And of course, there's also Delta 10 and all three do have the same effect. Once passing through the liver, they have the same effect as the marijuana or the Delta 9. So, we, you made me lose my train of thought there. Okay. So anyway, so we, yes, it was discovered that the body does produce the same thing that the plants do produce. And there are two receptors that do have an affinity for what the plants produce. Or we're going to call those the phytocannabinoids. So the endocannabinoids of what the body produces, and they do create stability or homeostasis, as it might be mentioned in the medical area. But what it does, it creates balance within the system. If the system is producing too much of something, or for an enzyme, or it will bring it back to stable state, or below, bring it up to stable state. Mm-hmm. So that's what the cannabinoids do. And very little is being studied right now on that, although the rate of the research is increasing, because I think it was recently the Congress approved and okayed that we can now study the plant more in depth, which things were being prohibited before. So
why do you think it was being so prohibited before? Just to study it?
Yes, you would think that. Well, again, I feel that it was masked by the THC, the tetrahydrocannabinoid, the Delta 9. It was just thought of, it was demonized by our society, that it is a bad thing. We shouldn't touch it at all. It is for basically for the poorer of the society that were utilizing very much. It became illegal, of course. I don't want to go into politics very much, but it was being brought across the border from Mexico and so forth. And the minorities were the ones that were using it a lot. And then that's all I'll say about that issue. It can be studied elsewhere if you want to look at it, at the history of it more. But this was in 1937. That's when it actually became illegal, and a tax was applied to it, and it was being brought in, imported, and the tax was levied. They called it marijuana tax law, and so it made it illegal for the average person to utilize it. And it wasn't until 1969 that it was considered unconstitutional, and it was back on the market. But in 1970, it was placed on a Schedule I drug by DEA, the Department of Drug Enforcement Agency, brought it back to where it was illegal for the average person. I have a DEA license to prescribe medications, and it starts at Schedule II. It will be very difficult for me to get a Schedule I, which for me to be able to prescribe marijuana. And so it wasn't until now, in 2018, that it was brought back in that hemp was now legal, providing it is less than 0.3% of THC. And actually it's Delta 9, although Texas do have a law that it's all THC that need to add up to 0.3%. But
so if you're growing the cannabis and do you have to send it to a lab every time you grow it for them to test it?
Yes. Well, it's a little bit more than that.
Yeah.
You have to get a license to plant the stuff in the first place, and before you can get a license to plant, you have to take a course. And after you plant the product, when you're ready to plant, you take a course, you get a license. When you're ready to plant, you have to get a crop permit, and you have to identify the location of the crop, where you're going to place a crop, and so forth. And then the crop grows. They give you 4 to 6 months for the crop to grow. And when you're ready to harvest, someone that is licensed by the state comes in and randomly select buds that will be taken to a lab that is licensed to do this test. And once they've tested it, they'll submit the test to the state. And the state will tell you whether you have passed or failed. If you have failed, they will give you another chance to submit a few more buds. And if you pass that, then you have 90 days to harvest. If you have failed it, in other words, if it's above 0.3%, then you have to destroy the crop. And there are several ways of destroying it. One is burning. The other is, tilling it back in the ground, and a few other methods of destroying it. Now, we decided
they burn it to destroy it.
Yes, and we thought
was you getting high off the.
Yeah, we thought of burning it to destroy it, but and selling tickets to come and downwind, congregating downwind. but we decided not to do that because we live in a small town, and Gonzales is very much for that idea of me burning that stuff. So anyway, we tilled it back in the ground. We shredded it and tilled it back in the ground. And that's where so we had to take pictures and submit the pictures to the state that we have destroyed the crop and so forth. And so that's what we have to go through for the and so each crop we have to get a crop permit for.
Wow, sounds arduous. So you said I think you said in the 1990s they started doing studies looking at the THC levels and things like that. When did you start looking into this?
Well, I started looking into it with the just idea that is CBD, that is produced by the plant, and that I wanted to submit it, wanted to share it with patients, just CBD, not the THC, with patients that I found out that it was very effective in taking care of pain. I started off with topical application, and I had a bad shoulder and started using it there, and then I found out that it took care of my shoulder pain. And so that's when I started paying attention to it. Of course, the patient that I had, that the cancer patient, that we gave her the medication, the substance. Let's not call it medication yet. The substance, and she was able to eat. She was able to. Her nausea went. Her pain went. So all three things were corrected when she started the medication. And this got my attention that I have to do something about this and have to participate in this project. Yes, there were the law passed in Texas that you could prescribe medical marijuana, but they only had 3 farms that could produce it, and getting to the patients is a little bit arduous. And so So I started thinking of planting the stuff. Plus, I had a piece of property that I needed to do something agriculture on, so that I don't have to pay the enormous amount of taxes. And so we started there, and then we realized that I had to do an extra step in order to produce the edibles. When you have a farm, you can do topical applications, but in order to produce edibles, you had to get a license from the Department of State Health Services to be able to do that. And I went on and did that. I had to take fingerprints and pictures and go through a process in order to get that license, and have to have a licensed commercial kitchen to produce and so forth. So we've been doing that, and it looks like it's been taking off pretty well. Patients have been giving testimonials on the utilization of the products, that it's been helping them. I feel that based on a few patients of mine, well, at least for one patient, I know for sure, it's the answer to his narcotic use, his oxycodone use. He has stopped using his oxycodone, and now he's utilizing we make candies, actually, and we do have some tinctures too. Planning to make capsules, but we have not done that yet. And he's using half of one of our brittles. That's around 15 milligrams of cannabinoid diol or CBD, and around 15 milligrams twice a day, and that has been taking care of his pain. He's totally off of his hydrocodone and doing very well with that. And as a personal note, myself and my shoulder pain, I broke my shoulder several years ago. I'm using the tincture, that's oil, on my tongue on a daily basis. And now I can sleep on my right side. My wife wondered why I'm not hugging her.
Why aren't you spooning with me?
my shoulder hurts. I can't lay on it. I didn't tell her that. No, she's understanding. I tell her, yeah, my shoulder usually hurts. That's why. Can't sleep on the right side.
So doesn't this mean, like, if this seems to be healing a lot of people, if not at least treating them, doesn't this mean isn't this less business for you in the long run?
Well, I can say, you said healing. I'm not sure it is healing, really. So far, I can say it's palliating.
Okay.
And that I can say, but there are some studies that need to go into whether it's healing. Healing, yes. As far as in Oregon, there's a study that's being done there. Well, they had a preliminary report that utilization of the CBD has prevented the infection of COVID, and has also cured COVID. And that's a preliminary report that they have that's going on. So yes, for COVID, it has resulted in healing. Yes, I recently started introducing this, 3 or 4 years ago, to my patients once I discovered that the topical application was so useful. And I'm not seeing a lot of patients coming into me for their aches and pains anymore. It's reduced my practice a little bit, but now I'm finding a few patients coming in asking for the alternate therapy that for their pain that I do provide for individuals. And we have one patient that she sees a neurologist. She has MS, and the neurologist, of course, did prescribe the THC for her, which has been very effective in treating her condition. She has a very, should I say, resistant. All MS is actually resistant to many therapy, but she has been doing very well on this therapy that this doctor prescribed for her.
Wow.
Reducing my complaints in my practice,
But that, hey, that's what it's supposed to be about, you know. It's
yes, yeah, treating patients is what.
so what does this mean? Like if there are more doctors out there like you who are coming up with these different ideas, these more revolutionary ideas of treating people's pains, what do you think this means for the future of medicine?
Well, there will always be conditions that this substance will not treat. Although in for many years, this is considered to be the first crop that has ever been cultivated, and it is cultivated for the sole purpose of it's been a go-to medical condition. I mean, medical therapy for many years, dating back to 500 BC. And so definitely it's been utilized through the ages for treating various conditions.
Mm-hmm.
And yes, it's gonna be revolutionizing the medical field. And I feel that the big pharma realized this, and that's why it's made so difficult for me, for one, to have gotten started in producing this or marketing this therapy. The the banks will not allow you to open a checking account if you're sat down with the bank, and they went through the process of me opening the checking account, and finally I'm ready to sign the paper. The final question.
Can you say? Sorry, can you say that one more time, because it broke up for a little bit. It cut out.
Okay.
Like back up like 10, yeah, like maybe 10, 15 seconds.
Okay. And so the I feel that the pharmaceutical companies are behind not wanting to utilize this substance because getting started and starting out with a checking account, I was told, never mention that you are in the business of utilizing hemp as your product. But I just couldn't do that. So I sat down with my favorite bank, opened up a checking account for the name of my company is Jamin Canna LLC. And we went through the complete process of getting my checking account opened up. And this is the first time I've ever been asked this question by a bank at the end of opening up a checking account, which I've done many. Are you planning to, your business is going to be including CBD, hemp, or any product from the hemp plant? And she asked me a question before, but I kind of masked over and just answered it's agriculture. But when she asked me about hemp and CBD, I had to say yes. And she said, well, I need to speak with someone about this. And so she left for a few minutes and came back. And I'm sure she went to powder her nose or something and told me, no, we cannot open this account for you.
Wow.
Sent me on my way. We were trying to get online and get an internet program going. And we went to GoDaddy, we went to Shopify and a few others. And once we put the word CBD in, they just kicked it out. or HEMP, they just kicked it out. Couldn't go any further with setting this thing up. And so finally we found Square. Now Square has a specific program for hemp and hemp product. So Square was a savior. And a local bank here in Gonzales, which is very local, they're originated here. I had to answer a lot of questions. There's a form that we had to fill out. I had to give the report of the last test that we did, whether we passed the state level of THC and so forth. And finally, they sent it up the ladder, and they came back, and yes, they allowed me to have an account there for the Jamin Canna. So I feel that the big pharma has a big task here, and they're succeeding in it. Dr. Phil and Dr. Oz got involved in this, and they were trying to buy them out. The big pharma is trying to buy out their system because there is that threat. Because there are so many things that is thought that this condition, this substance, let's call it a medication. This medication can cure, and that's pain, mood, movement disorder, multiple sclerosis, glaucoma. We always knew about glaucoma for 100 years with THC, and spasms and spinal cord injuries. Those are the things that we're looking at now to see how this medication can actually treat these conditions.
Yeah, imagine when they really start allowing us to experiment and do things, and it becomes mainstream. Imagine how much more we would actually have knowledge of what this plant can do.
Well, there are medications now that are being produced that actually attaches to the CB1 and CB2 receptors that the pharmaceutical companies are attempting to do. There's for example, one that has high triglyceride. Fish oil. It's ordinary fish oil does a good job of bringing down the high triglyceride. And the pharmaceutical companies came up with Vasipa, and stating that it does a better job. Well, of course, more concentrated, it does a better job, but you'd have to eat more fish or use more fish oil to compete with so they will come up with medications and so forth. But as far as I'm concerned, I'm going to be focusing on the natural product, that the phytocannabinoids, rather than and to have use that to enhance the endocannabinoid system.
Nice. So what kind of products do you have? You want me to pull up this?
Yes,
this
we have. This is what my product will look like on the shelf. This is the pecan praline. Praline, is it? Yeah, it's pronounced that way. And this is a chocolate leaf. They call it lucky leaf. And we also have some tincture. And as you can see, I'm kind of proud of my Jamaican.
Yeah. Can you see the
Yes.
sides?
So there's a pecan praline and the chocolate heart, and also the chocolate leaf. We call it lucky leaf. We get a mold from the plant, and then the tincture. And those are the prices. They're pretty expensive because they're really truly expensive to produce, but because of the reward that you receive from utilizing them, people have been shopping very heavily and utilizing these products very much. And there's the next slide. Neil, you can show that the JamInCanada.shop is where we find them. And we went to .shop. Well, no, we weren't rejected. You can do .net or .shop. We didn't get into .com, but .net or .shop, you can get into our website. You can purchase online the products that we do produce, and we'll be increasing the amount of products. Basically, we're just going to be having THC, Delta 9, that is legal level below the 0.3%, and the CBD. And I'm now cultivating CBG, which CBG is cannabinoid gerol, is considered the stem cell of all the cannabinoids. In other words, from there you can branch out to, the CBG has been known to be very effective in therapy for various conditions also.
Interesting. Well, thank you so much, Dr. Vaz. This has been a very informative presentation here.
Yes.
And I think you're doing great work, man.
Thank you, thank you. Feel free to email us, or I didn't. Our telephone number is not posted, but it is it's 888. Your code is 830-888-3121. That's 830-888-3121. It's a telephone number. And give us a shout.
And I'll also post it. I'll post it in the description in the video.
Very good.
As well, yeah.
Thanks for having me.
Fantastic. Any last thing you want to add before we wrap it up?
Well, just that. But I feel that now that we are allowed to study and plant this shrub, I feel that it's going to revolutionize the market tremendously. And whether big pharma is opposing it or not, I feel that the individuals, based on my experience here in Gonzales, since I started producing it and selling it locally here, folks have been really raving over it and utilizing it. And if that gets out to the rest of the United States and the rest of the world, that the same attitude will be exhibited.
Nice. Yes. Jammin' Canna.
Yes.
I like it. With a Jamaican flag. A lot of mercy. Yeah, man. Well, thank you so much, Dr. Vaz. This is Dr. V's Revolution Will Not Be Pesticides. And we'll see you guys later. Peace.